everyone, and welcome to another episode of What's Working. I'm Cam Marston. What's Working is brought to you by Regions. The focus of our show is workplace and workforce trends, the trends that will make you a little bit better at what it is that you do, as we understand how these trends are shaping the people that we interview on this show. My goal is to get them to tell us what's going on in their business. A lot of it has to do with the story of their business. And once we can capture that story and understand how things are shaping their business, perhaps we can take some of their ideas, some of their experiences, and utilize them in our own businesses, in our own workplaces. So we seek the people that can help us get better by telling us the story of their own workplace. If you're a fan of the show, you may be aware that back in March, in the immediate aftermath of in the beginning of the COVID crisis, I began a 1 p.m. broadcast live on FM Talk 106.5, and with the goal of trying to help small business understand the impact of COVID and how it's impacting their workplace, and interview people from all walks of business to get some insights into helping small business stay alive during the COVID crisis. At the tail end of each show, one of the kind of signature sign-offs that I tried to develop was to get somebody on the air to leave us with some inspiration, some motivation going forward. Because goodness knows there's a lot of reasons and a lot of ways we can get down or could get down based on the rolling out of the pandemic and the health issues it caused. And at the time, all the medical supply shortages and the huge unknown. Anyway, the goal of this 1 p.m. live broadcast was to get people attuned to things that will help their small business and finish with a little bit of hope, spirit, motivation going forward. So I began to try to find these people. And one of the people that I came across, and I don't remember exactly how I found her, was Kim Garrett. Kim works at Victory Health Partners, and she came on for a brief moment or two towards the end of one of the shows and told us a little bit about who they are and what they're doing and the way they're staying motivated moving forward. And it was that brief conversation with her that made me aware of what it is that they do. And I'm somewhat ashamed to say that as a citizen of this town for over 10 years, born and raised here, but returned to Mobile 10, 12 years ago, I was unaware of the significance. And then I began to look through this annual report that I got from them and realized that many of my peers and colleagues have been involved with this organization for a while, and somewhat shame on me for taking so long to become aware of them. In this show today, we're going to speak with Dr. Robert Lightfoot. He's the executive and medical director of Victory Health Partners. He started it a while back, and we're going to get the story of this organization, how it's grown. Now, they're a nonprofit organization. They deal with people that typically can't afford the costs of medicine or medical treatment. And the people that work there are extremely committed to the cause. They are a Christian-based organization. And I'm going to talk to him about how that influences the way they deliver their services, etc. Folks, the hope is always there's something that we can learn here that will make us a little bit better at what it is that we do. When I talk to purely business-minded people, I know that there's a practice or something that I can hijack from them that will make my business a little bit better. Goodness knows this show and the countless thousand questions I've asked people have indeed helped me with my own business. This one's a little bit different today. Certainly, I'm going to look for ideas and motivations and trends that are shaping their business and understanding these trends and how they can impact and influence me. But I might also be looking for a little motivation, a little of the, let's say, the stirring that keeps these people going day in and day out with an attitude of servitude. And I'm really curious of where their well of energy and enthusiasm and generosity comes from and how it gets filled on a regular basis in what, especially in these COVID times, could be a challenge to anyone's motivation. When we come back, I'll have on the line with me Dr. Robert Lightfoot of Victory Health Partners. We'll begin with his story. I look forward to this very, very much. From what I remember talking to Kim, the story is going to get really good here in a moment. You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by Regions. We'll be back after this short break.
Even if we don't meet in person, Regions is still here for you. We make it easier for you to stay informed and in control with online and mobile banking. You can check balances, transfer money, pay bills, deposit checks with Regions Mobile Deposit, and even set up helpful alerts no matter where you are. We're here to make it easier to bank your way. Learn more at regions.com/tools. Regions Bank, member FDIC.
A cool thing happened back in '64. That's when Keith Air Conditioning opened their doors.
In my family, turn to the experts is more than a tagline. It's a promise. Every Keith technician is an experienced AC professional, and that saves you money. Speaking of money, how about 0% financing for up to 60 months on installations of new Carrier systems? Keith and Carrier, turn to the experts.
Mobile's leading name in comfort since 1964.
License number 83731.
The best, most cost-efficient ways to talk to customers about who you are and what you do is through signs, simple, effective signs. Hi, I'm Cam Marston, host of What's Working. Signorama is the Mobile area's leader in helping you design and build signs advertising your business. What kinds? All kinds of signs, all kinds. Find Signorama on Facebook or at signorama-mobile.com.
Think about how people really see you. The kid at the drive-thru just sees a coffee drinker.
Please pull forward.
Your local barista sees the person who loves a smiley face in their latte.
See you next time.
It's kind of the same way with insurance. Other insurance companies just see a customer, but a State Farm agent sees more. They see you as a neighbor. Your State Farm agent is here to get to know who you really are, so they can help life go right.
Call me, State Farm agent Allison Horner, in Mobile at 666-1616.
You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by Regions. On the line with me is Dr. Robert Lightfoot. He's the Executive and Medical Director of Victory Health Partners in Mobile. Dr. Lightfoot, I got a bunch of stuff in your bio here that I'll get to as the show goes along. But first and foremost, thank you so much for your time. Welcome to What's Working.
Well, we appreciate it. Glad to be here. Thank you for having us.
So your organization has quite a history here locally, and I'm ashamed to admit I'm not as familiar with it as I would be, but as I should be. As I look through your annual report here, the people that are involved and have been involved and the number of patients that you all have touched over the years is really very impressive. Let's begin with the story. Where did it come from? Where did the idea come from, and how did it begin?
Well, for my wife, Tammy and I, we went to the Brownsville Revival in 1997, and it really was, for us, it was a lordship moment with Jesus Christ and radically changed our lives. And then through our church, we were kind of actually goaded into going on a mission trip to Venezuela. I'll be honest, we were goaded. We really weren't sure that we were supposed to go. But during that trip, and we were in the middle of nowhere, Venezuela, for a week, and in 4.5 days, the medical team saw over 3,000 people. And these were people from Venezuela that literally did not have 2 pennies to rub together. And we're in the middle of nowhere doing Band-Aid medicine and serving these poor. And I remember looking at my wife, Tammy, and she looking at me, and we both kind of said, I'm really comfortable doing this. Now, that was a scary statement for both of us because we were in Mobile. I've been in practice of general surgery with my brother for years. Loved what we did, loved being in Mobile. And yet this was a focus change moment. It was one of those where God changed our focus from what we were doing to what we would be doing. And we came back and we began to kind of pray over that and talk with people. And a lady in our church actually told us about a clinic in Montgomery that a doctor and his wife had started that really, she said, when I heard about this clinic, I thought of y'all. And I think we were in Montgomery the next Wednesday or Thursday, and we went to visit that. And then this clinic was actually modeled after a clinic in Memphis called the Church Health Center. which has now been in existence over 30 years. And God really arranged for us to go spend 4 or 5 days in Memphis and to tour that and speak with everybody at that facility. And it was one of those moments where a really fuzzy picture, a fuzzy vision became very clear. And I remember being up there and literally putting my hand on the wall and saying, "This is it. This is what we're supposed to do in Mobile. Now, how do we do that?" And we came back to Mobile and we began to speak with everybody in the healthcare system in this area, everybody that had anything to do with healthcare. And what became identified for us was a group of people that were really falling through the cracks. They're the ones that were having the most trouble gaining access to healthcare. And that group was lower income, uninsured adults. Not children, not pediatrics, which is really well covered for lower income people in the state, but the adults from age 18, 19 up to Medicare age. And that group at the time was somewhat over 100,000 in Mobile and Baldwin County, somewhere around 120,000. And those are the people that were falling through the cracks that ended up in the emergency room or urgent cares most of the time for their health care. And when we began to look at who these people were and who they are, they're our friends, they're our hairdressers, they're our servers at restaurants, they're our construction people, they're small business owners, they're people that sit in our pews in church with us every day, they're our relatives. They truly are people that we know. And they're struggling to make ends meet, and what usually falls out in the juggling act of their budget is their health care or their medications. So that group, like I said at the time, was about 120,000. And my initial idea was, if we can serve Mobile and Baldwin County and get this up and running, then we can serve those people. And a group of people came together and began to pray toward this, began to come together and really began to plan and look toward that. And then there were a few major hurdles to overcome. We needed some place to do it.
Mm-hmm,
we needed a building. And we looked at, there were lots of empty buildings at the time, years ago. This is 20 years ago now. And we actually were given two buildings for free, but neither one was really right, and neither one was what we thought we needed. But we did look at one building that was an old medical office. It's pretty centrally located. It's off downtown or Boulevard, right close to I-65 and I-10 corridor.
Yeah.
It was 11,000 square feet. It was a medical office. It was empty, basically. And the only problem was that it was on the market. It was owned by the Infirmary Health Systems, and it was on the market for $850,000.
Mm-hmm.
And we didn't have $8.50 to our name. And weren't going in debt. So the only thing we needed to do was to pray.
Yeah.
And we literally prayed for 2 years. And then a gentleman named Jimmy Bledsoe came to us and was interested in working with us, very interested in helping the clinic get going. And what I didn't know, and never met Jimmy before, and I didn't know at the time, was that he was the outgoing chairman of the Infirmary Health Systems Board of Directors. And as I told him what we were looking at and what we needed to do, he said, "Well, let me make some phone calls." It wasn't but a few weeks later, Cam, that the board of directors of the infirmary unanimously voted to lease the 11,000 square foot building to us for $1 a year, and which is hundreds of thousands of dollars of rent every year. And what he didn't know, what the board didn't know, was our little group of prayer team is that we prayed for that building, and we prayed for $1 a year rent. And that's exactly where we ended up. So we moved in 2002. I left my private practice at the end of the year. 2003, we opened up. Goodness, hundreds and hundreds and hundreds of volunteers came to redo the inside of the building and to upgrade things, and probably about $75,000 worth of work was done for about $5,000. So, as our name says, Victory Health Partners, the partners came forward and the community came forward to make this possible. So we opened in 2003 with 12 patients our first day, and now we're finishing our 18th year with over 24,000 patients of record for the clinic.
Let me expand on that. I'm looking at your annual report. 2019, 45 counties served in Mississippi, Alabama, and Florida. $20 million of care provided within the clinic. 19,500 patient encounters in 2019, $39 million in medication provided at no cost, 60,000 volunteer hours. I would say it's been a resounding success. I'd say you found your mission. The 2 years that you prayed, hoping for this facility to come available, was there ever a time where you thought, all right, guys, in 2 years we've been praying, let's say 18 months we've been praying, and we've made no ground. Perhaps this is a way of being told that we need a different plan. How did you stay focused for that 2 years? That seems like a long time.
Yeah, it was a time of planning and preparation anyway. And I believe that anytime God gives somebody a vision and a mission, as he gave our group and us, he's behind the scenes working before you even know he's working. And so we knew that, we just knew in our spirit that this was where we were supposed to be. And even though, like I said, a couple buildings were given to us, but we knew that they weren't right. So we knew we needed to persist, but we were busy at the same time. I was still working full time, and we were doing this, just doing the planning of it, just getting ready. Even though we didn't have the building, we knew it was coming. And so we knew that if we just persisted, and even a lot of times when you get to the point where you just don't think it'll ever happen, it's probably going to happen right after that.
So hope for giving up quickly, and then it'll happen after that, if that makes any sense at all.
Yeah, exactly.
Yeah. You mentioned that the primary patient that you care for are adults, that the children are generally well cared for in this, to do my study, my profession, which is kind of understanding demographics. In the demographic world, the children that we're talking about here are generally well cared for by the state, but it's the adults that follow through the cracks. Is there a predominant age of adult that you see in your clinic?
It's, we see everywhere from 18, 19 all the way up to in their 60s,
Yeah.
but the majority are what I'll call younger middle-aged, maybe 40s, 50s. These are, people that most of the young people really don't have that many illnesses,
Yeah.
so they're not seeing a doctor that much.
Yeah.
There's some, and then we see them, for acute things. But what we're really looking at, most of our patients have chronic illnesses, high blood pressure, diabetes, high cholesterol, heart disease. And those are the ones that, if they don't take care of it, they end up in the emergency room in the hospital in
Right.
a much worse situation. And, one major hospitalization for this demographic, for these people, could ruin them financially the rest of their lives, and put them into unbelievable debt. So, one of the things that we want to be able to do is to give them a place where they can have a doctor in a doctor's office, and they can get the usual preventative care. They can, get the medications they need. One of the things that you mentioned was the amount of medications that we dispense. One of the things that we worked very hard on is every pharmaceutical company by federal law must have a patient assistance program, which provides free medicines for lower income people without insurance.
Mm-hmm.
And we do the paperwork, which is pretty cumbersome.
Yeah.
And we take care of all that, get it ordered, get it into the clinic. And last year it was over $39.4 million worth of medicines that were free to our patients. So,
unbelievable.
That means that they have their medicines. The generics are easy to get. That's not a problem. It's the name brand, big name medicines that cost so much. So they can stay on their medicines. They can have a doctor they can come see affordably. One of the other things that just came forward for us was the medical community of Greater Mobile and Baldwin County is really a tremendous medical community. And they came forward from the very first, wanting to help in some way. And what worked out for these partners was that they would start seeing our patients in their own office, but for just a small copay.
Yeah.
So for a $35 fee, you could go see a cardiologist or an orthopedist. Well, that's the next step in healthcare that most uninsured patients will have almost no way that they can make that happen.
Let's take a break here, Dr. Lightfoot. I need to go to a commercial, and we'll come back and we'll pick up where we are. You're listening to What's Working. I'm Cam Marston. This is all brought to you by Regions. On the line with me, Dr. Robert Lightfoot, Medical Director, Victory Health Partners. We'll be right back.
I'm Matt Armbruster with Ransom Ministries. We help people in our community that most others have given up on. Please donate your unwanted electronics to Ransom Recycling. We teach life skills, job readiness, and job creation through our electronic recycling program. We take anything with a cord. Find us at ransomministries.com, or you can call us at 251-751-0044.
Human Resource Departments spend countless hours on insurance billing mistakes, Obamacare rules, and compliance. Employee benefits serve the purpose of recruiting, retaining, and rewarding employees. We can handle all of your benefit needs with cost-effective products, employee enrollments, and handle your HR issues. Benefit admin doesn't have to be complicated. My name is Michael Cowart Jr. of the Cowart Group, and we specialize in helping businesses with their employee benefit packages. Visit cowartassociates.com.
Hi, I'm Cam Marston, host of What's Working. My Carrier Infinity system is quiet, energy efficient, and runs like a dream. To keep it running smoothly, I rely on a maintenance plan from Keith Air Conditioning. With a Keith maintenance plan, your home or business receives discounts and 24/7 priority service. Give Keith Air Conditioning a call today at 251-476-3610 or visit keithair.com. Keith and Carrier. Turn to the experts. Dr. Robert Lightfoot is the Executive and Medical Director of Victory Health Partners here in Mobile. Give you a little bit more of his bio. Graduated summa cum laude from Auburn in 77, medical school at University of Alabama, graduated in 1981 with honors. Dr. Lightfoot, prior to the break, you were talking about the partnership you've developed with a number of the local doctors who don't practice in your facility, but see the patients that you send them. Is that about right?
That's right. We have over 150 specialists, doctors, podiatrists, chiropractors, physical therapists, really kind of across the board that came forward and agreed that they wanted to help and see our patients. So just like everybody else has an appointment to go see, their specialist, we're able to refer and get the next step in healthcare for our patients. So for one of our patients that normally it would have been $200, $300, $400 to go see a specialist, it's $35 to go see them. And that amounts to, I don't have a number to put on it, but probably millions of dollars worth of donated services to our patients. And it affords them to be able to see that specialist and have that next step in healthcare.
Dr. Lightfoot, I'm very curious that you're a man of science. You've got a remarkable scientific background, which is what medicine is. You've achieved. You graduated summa cum laude. You graduated medicine with honors. How pair your belief in science with your belief in the spiritual, with the Christian mission of your organization. It seems to me that there are many people with such a founding in science kind of dismiss the spiritual, or in your case, the Christian drive. Talk to me about that.
Well, you can look at it from all different directions. I mean, medicine is a science, absolutely, but it's also an art. There is the art of medicine, which I think it expands over a whole lot more than just the science of it. But also the way from our faith that I look at this is that there is a God who is our creator and our father. He is the one true God, and he created us spirit, soul, and body. If we just look at the body and don't take care of the soul, which is the mind, will, and emotions, and the spiritual part of somebody's life, then we've only partially treated them. And we can take care of the body, but there's things that cannot be healed except through the soul and the spirit. And there's now study after study after study on good medical studies on the importance of faith and beliefs in the health of people's lives. And, what that is showing is what we've known all along, and really what faith community has known all along, is that your faith and your beliefs and your spiritual part of you is extremely important in your overall health and well-being.
Has this been a part of your upbringing, or is this something that came to you later in life?
I'm a fourth generation doctor, so I've grown up in medicine my whole life. My brothers are doctors. My father was a doctor, going all the way back to my great grandfather. So I've been in medicine, since I was a kid.
Yeah.
I went on house calls with my dad. I worked in the hospital. I spent time around. So the medical part of it was always there. And one of the things about the heritage of my family and doctors is that they've always taken care of whoever needs the care. It was just part of what they did. And if they could pay, that was fine. If they couldn't pay, that was fine as well. So there's been instilled in us the art of medicine, of taking care of people no matter what. So that's been instilled in us for our whole lives, and maybe it's part of our DNA at this point. But also, when you look at the history of healthcare through all the centuries, truly the faith community, the Judeo-Christian faith community, is the center and has been the center of healthcare. And Methodist hospital, Baptist hospital, Jewish hospital used to be truly Jewish, Methodist, and Baptist. And some of that has continued. The Catholic churches in the area, they've continued that. But to some degree, when government became involved, when Medicare was developed, and then insurance became big, and then Medicaid and all these things, the faith community abdicated a good bit of its control of healthcare and stepped aside, and healthcare became big business rather than a true calling. And in that process, I think the faith community abdicated and walked away from what our real commission is. We're commissioned and commanded to take care of the poor, the sick, and the widowed. That's Old Testament, that's New Testament. And when we walked away from that, we abdicated the position in the community that we were rightly to have and should have. And so part of this is, I believe, the faith communities recapturing what our commission is. We are to be the head and the major part of healthcare is to be from a faith standpoint. So I see Victory Health Partners as a, trying to get back to what we're supposed to be doing. And this is happening all over the country. There's clinics similar to us in every area of the country. So it's working everywhere.
Do you require anything of your patients in regards to faith? Anything? So I can imagine going to a cardiologist and them saying, here's the diagnosis and here's what the machine says and here's this and this. And by the way, let's spend a few moments in silence, in prayer. That would seem very odd to me, considering the taste or the experience I have in medicine. Do you require anything like that of your patients?
No, absolutely not. I mean, we do not require. You don't have to hear the gospel before you're treated.
Right.
We don't, beat people over the head, so to speak, with the Bible. But I really look at it that what we're there to do is to share the love of God for every person that walks through that door, no matter where they're coming from. Now, in that we're blatantly Christian. We have Christian biblical verses all through the clinic. Everything there points toward why we're there.
Yeah.
And that is not to force somebody into something. It's simply to say, this is why we're here. This is what we want to be able to do to help you. But in the caring for people in a medical office situation, you become a very important part of their lives and their family lives. And as you take care of them over the time, that affords you the ability to be able to, see where they are in their faith walk or without a faith walk. And we're often asked, why do you do this? And it gives us a chance to testify to the reason that we do this. We can pray with patients. We can, work with them. We can help them. We can do anything, there. And that's, one of the things about being a doctor is an incredible responsibility, but it's also, a great honor to be part of somebody's life that, maybe very few people in their lives have the same access as their doctor.
Yeah.
So, in that we're able to actually, be able to bring them, to the one healer. Absolutely. There is for me only one true healer, and that's Jesus Christ. And to be able to share that love with people, in a direct or indirect way is really the core of who we are. We're a ministry first, and by the way, we do healthcare.
Isn't that fantastic? You have said something that so many of my so successful guests on the show have said, and that is the work that they do is essentially a charade for a bigger purpose. And that perhaps charade is a wrong word, but my goodness, that comes out over and over again. Your ministry is number one, and by the way, we do healthcare in the background. And it's been that way with so many of the most successful guests. And I look at success meaning the growth of their business, the influence of their business, the influence of the people to spread their message, if you will. Golly. Dr. Lightfoot, this show is focused on workplace and workforce trends. And one of the trends that is undeniable is what you've just said, is that healthcare is in the background of what you're there for, essentially. And that is a theme that I've heard over and over again. All right, that's enough of me. We're going to take a break, Dr. Lightfoot. I want to come back and ask you this question, two questions. Number one, how have things changed in times of COVID for you? And number two, what do you need? What do you really need? We'll be right back after this break. This is What's Working. I'm Cam Marston. What's Working is brought to you by Regions.
Do you have a plan to protect your income if you can't work? We'd all like to believe that we'll never be disabled, but the reality is it could happen to you. And if it does, will your income be protected, your family be cared for? Richard Otts has served the Gulf Coast since 1997. If you'd like more information about disability insurance, contact Richard 251-342-8917. That's 251-342-8917.
That's the sound of rush hour. Hello, recess.
Mom!
Work from home is a lot of work. Even though we're a little further apart right now, we're still in this together. Regions is donating this ad to local food banks to shine a light on them as they feed our neighbors in need. Learn how you can help or get help at regions.com/foodbank. Regions Bank, member FDIC.
Think about your home. What do you see? Do you just see 2 stories or the stories of your toddler's first steps? Now think about your car. Do you see an odometer reading or your kids reading in the back seat? Other insurance companies just see a house. They just see a car. But a State Farm agent sees what your home and your car really mean to you. So why not give them the protection they deserve?
You can reach me, State Farm agent Allison Horner, at AllisonHorner.com.
We're back. Dr. Robert Lightfoot is on the line with me. He's the executive and medical director of Victory Health Partners. He's a member of the Medical Association of Alabama, Mobile County Medical Society, Christian Medical and Dental Association, and a fellow of the American College of Surgeons. The man is highly qualified and highly motivated. Dr. Lightfoot, tell me quickly, how has COVID changed what you guys are doing? And then we'll get into tell me what you'd need.
Well, it's been a different season.
Yeah.
To put it mildly, I know for everybody. Certainly, we needed to be there for our patients, and we needed to stay open. So our focus was how can and what can we do to stay open as much as possible, be available for our patients. And also really for my small paid staff, was one of my primary things was I want them to be fully employed and continue with their jobs. And it changed. Our numbers went down. People were afraid to come out. Really sick people were really directed toward the emergency rooms and those things. And so we saw a dip and it kind of restructured how we were doing things, but it's become, it started to build back up and we're really back to more than we used to be. One of the trends that we saw is that we were seeing a good number more new patients. And these were people that had lost their job or been downgraded or just lost their health insurance through their employer during this. And they were a lot for the first time without health insurance. So we became a resource for them to get back. And we love for our patients to get health insurance. We call that graduation day.
Yeah.
I'm the only doctor in Mobile that loves to see my patients leave because that means they get insurance. But so there was definitely a downturn there. Our patient fees only amount to less than half of our budget every year. So, being a nonprofit, we have to raise, over half our budget every year. So obviously there was a great downturn there, but God has been incredibly faithful through this, and the community has stepped up tremendously. With foundations, individuals, corporations, and we were able to make up that loss. Our one major fundraiser that we do every year is Hope for Healing Celebration Banquet. Had to be postponed completely, so our number one fundraising event was put off. It has been rescheduled for next year, but so there were major hurdles to overcome, and our director, Kim Garrett, and our board and our entire staff really pitched in to be able to make that happen. So we were able to maintain and continue to grow even during it. It did change a little bit of how we did some things. So overall, it's been a hard year, but a good year for us.
So you told me when you were hoping for the building to launch this organization that you all prayed for 2 years until it finally happened. Is there another singular focus of prayer right now that you and your team are focused on that will take you to the next level? My hope, of course, is that if you can articulate this, there's somebody listening that can help.
Yeah, we prayer is always a center of what we do, not only for my wife and I and the board, but also our staff, and praying for our patients, praying for all that's there. The need has not gone away. The need is not going away. The numbers in Mobile and Baldwin County alone are still around 100,000 adults without insurance. And I don't foresee any answer to that in the future. So, we need to continue to grow. And to be able to do that, we're going to need, more and more support. We're going to need to be able to expand. Our wonderful 11,000 square foot building is about to bust at the seams with everything that's going on in there. So more space and more partnership is somewhere in the future. So we're looking toward that. So, our prayer focus, one of the things that we've tried to do, and I've tried to do, is to look forward, but stay in the moment. And so that, yes, we need to pray toward, Lord, what do you have for us in the future? How do we grow? How do we do those things? But to really be able to stay in the focus of the day, where, Lord, how can you use us this day in these people's lives, or in our staff's lives, or our volunteers' lives? How can we do that, and how can we glorify you in that? So our prayers are always, my prayers and my wife's prayers are always forward, but also to stay in the moment of the day. So that's kind of where we are.
I didn't hear you say X-ray machine or MRI machine or, I need a helicopter where I can do some trauma stuff and fly to and from it. Nothing like that. It is, your prayer now is a greater intensity, in the right word, but a greater focus of each moment, of the moment now and what can be produced going forward, correct?
Exactly. And yeah, those things, there's things that will be needed to do that. And one of the things that really astounded me, I guess, and through this whole process of all these years was how, when God ordains something, he orchestrates it. I've heard somebody say, and it is absolutely true that what you need will be there when you need it. If you just stay in the moment of trying to, pursue everything that God's called you to do. So yeah, there are things that are needed. There's, staff that are needed. There are other physicians and dentists that are needed. But our job is to just keep moving forward, and all that will be provided as we go along.
How, Dr. Lightfoot, what is I can hear that you are a driving force, a charismatic, energetic force, a driving spiritual force. How many more years you got this in you? Do you have a retirement plan, or is this your calling to your last day?
I don't believe you ever retire. You may slow down or you may change your focus, but I don't think you ever retire. And I don't see myself ever fully retiring from this. It's such a deep thing in my spirit and the vision of it. But I will slow down. But we've added on. Kim Garrett is our director now, has such a heart for this vision and mission that she can carry it on from an administrative and vision standpoint. We have some wonderful physicians that are with us. Dr. Stacy Wing is full-time with us, and she's a lot younger than I am. And, so there's people to take this and continue it, because at some point we had to sit down and decide, is this something that needs to be ongoing, or was this a good 20-year run and we've done what we were supposed to? And there's no question in our minds that this is something to go on for perpetuity. And so therefore we need to be able to pass this on to the next generation of people like Kim Garrett and Dr. Stacy Wing and physicians and all. So there is a plan to be able to do that. The right people are in place, and at some point I'll back down from this or away from this, but I don't think I can give it up completely.
It's in your bones.
I can't. I just love seeing people and taking care of people. I'm not sure I could not do that.
We're running up on time, but I want to know, is any of your family involved?
My wife's been involved from the very first go, as I said. None of my children are involved as far as, day-to-day things, but, and my wife is not day-to-day with us now, but she works in lots of ways with the clinic. So, it's been a wonderful thing to be able to walk through a vision and a ministry with your wife, and for both of you to walk through it. That's been a great blessing in our lives.
Dr. Lightfoot, you're the kind of guy that people like me are just grateful to know they're out there and that they're doing what they're doing, and to, frankly, inspire, I can raise my hand here, me, for a greater purpose. And I know there are also people listening that are saying, gosh, I'd love to have this same motivation, this same drive, this same absolute confidence that the thing I'm doing every day is what I'm meant to do. And I wake up every morning knowing that the well will always be replenished. My motivation will always be replenished. It's great to hear your story. Thank you so much for sharing it.
Thank you for having me. I appreciate those kind words, but it's simply a matter of obedience. And it's something that is so deep in us that we could not do it.
Yeah, that's what I hear. That's what I hear in your words. It's wonderful. It's deep surrender.
Yes, sir. Yes, sir.
All right. Dr. Lightfoot, it's been a pleasure. Folks, Dr. Robert Lightfoot, Executive and Medical Director of Victory Health Partners. I know you can find him online quickly if you want to with a quick Google search. They're in need of what you may have. And I think it sounds like they're using it, whatever they can get for the betterment of our neighbor. Good stuff. You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by Regions. I'll be back after this short break with our final comments.
Do you sometimes wonder about different money topics, but struggle to find the answers? The Every Dollar Counts podcast with Gulf Coast experts Josh Knoll and Jay Stubbs is made for those folks serious about their financial plan and looking for answers. Josh and Jay dedicate their time to explaining the various services and products available, as well as discussing lifestyle and money interests of the modern-day family. Tune in to Every Dollar Counts on Apple Podcasts and everywhere else you get your favorite podcasts.
Hi, I'm Cam Marston, host of What's Working. My Carrier Infinity system is quiet, energy efficient, and runs like a dream. To keep it running smoothly, I rely on a maintenance plan from Keith Air Conditioning. With a Keith maintenance plan, your home or business receives discounts and 24/7 priority service. Give Keith Air Conditioning a call today at 251-476-3610 or visit keithair.com. Keith and Carrier. Turn to the experts.
Life insurance is one of those subjects that make people want to change the subject rather than admit they probably don't have enough. I'm State Farm agent Allison Horner, and that's why I focus on how the benefits of life insurance actually live on by asking people to think in terms of life without having to sell the house insurance, or life without having to give up college insurance. Find out how the benefits of life insurance can live on for your family. Call me, State Farm agent Allison Horner, and get to a better state with State Farm.
I think we can agree that whatever community Dr. Lightfoot exists in is going to become better. And I think we can agree that those of us that live here in Mobile are grateful and fortunate that his energy and his drive and his mission and his passion is focused on the people of our community here. I am both blessed and cursed, I guess, with an extraordinary curiosity. And I've mentioned this on this show in times past, that this show is really a opportunity for me. There are many motivations for this show for me, but one of them is to ask questions. I love to ask questions. My wife is fond of telling the story of when I was kicked out of a tour of the Biltmore House in Asheville, North Carolina, because we were in room 2 and we were already an hour behind schedule due to me asking so many questions. The tour guide said, I'm going to have to ask you to leave or we're never going to finish this. But it's the question. I love them. I love them. I was given this Walt Whitman quote not long ago, be curious, not judgmental. I am definitely curious. I can always work on my judgmental, but I am definitely curious. And it's the curiosity that allows me to meet people like Dr. Lightfoot, get time with him on the phone and be able to ask the questions that come to my mind. When I interview these people, and if you're a fan of the show, you've heard so many of them, one of the questions that I'm always kind of hesitant to ask, because I think it may be too personal, I guess, is why? Why are you doing this? Why have you started this business? Why have you courted this customer? Why have you done whatever it may be? We had Silver Ships on the show not long ago. Wonderful organization. Why? Why are you doing this? And never really got down to the depths of why. With Dr. Lightfoot, we touched why. In fact, he offered it up. His is a calling. It's a obedience, a submission. And my goodness, I don't know about you, but people that have the clarity of this calling, this clarity of obedience, are enviable. To wake up every day not having to wonder what you should be doing. By no means does it mean you wake up every day with nothing to do. In fact, it's the exact opposite. You've got so much to do because you know so much of what you need to be doing. Dr. Lightfoot is, again, the medical director of Victory Health Partners. Folks, Google them, find them online. If there's something you can do for them, I know they, like all organizations, nonprofits, donations are welcome. Financial, of course, but I imagine if there's something you feel they could use of yours that you have access to, they welcome the information on what that may be. Again, wonderful conversation. We are grateful to have this man in our community as well as the team. I know Dr. Stacy Wing that he mentioned a couple of times, and I know the quality of her as a person as well as her work, and I'm grateful that she's out there as well. We're lucky. That's it. Bottom line, we're just lucky. All right, that'll bring us to the close of yet another show. I continue to enjoy these things. We may have a new advertiser coming up here. Very exciting. We'll announce that as it happens, but indications are we may get someone new on board, and that would be great. The show is produced by John Thompson with Eye on Digital, EYEON Digital. If you want to check them out, they do great work, not only in audio, but video. I am heavily dependent upon John and his work, and he's been the show producer and has taken it to new levels. I'm grateful. You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by Regions. We'll have another show next week. Have a good week, everyone.